National Federation of Gynecologists and Obstetricians supported the Association of Gynecologists and Obstetricians of Uganda with a grant to advocate for the prevention of maternal mortality and morbidity due to unsafe abortions and related complications. As one of the countries with the highest fertility rates in the world, 46% of pregnancies conceived in Uganda are unwanted, at least according to the Makerere University School of Public Health. Most of those conceiving are disadvantaged teenagers who lack access to family planning services. They later resort to unsafe abortions that often turn fatal. Unsafe abortions and related complications account for 5% of maternal deaths in Uganda. Worse still, post-abortion care treatment is costly, posing a significant financial hurdle for an already limping public health system. Mary Adong is a nurse at Mulago Women's Hospital. She shares her experience of treating a girl whose uterus was removed due to unsafe abortion practices.
I came across a 12-year-old girl. Walked in a health center. I was working at that time, and she had sticks inserted inside her. She came in with a lot of pain. She could not walk straight. Only after doing an examination and maybe interviewing her, that's when she opened up to me. She was told by a friend that a certain judge would help her carry out an abortion. And the way of carrying out an abortion was through inserting a sharp stick. So maybe I just saw, after now doing an examination on her, I saw a lot of pus coming out of this girl. I tried sort of to shake those sticks that maybe they could be movable, but they could not. So what did I do next? It was really a big dilemma. I couldn't make up a decision on my own. I said, what could I do? At that time, I was like the senior midwife in that health center. We were working without a doctor. But I said, no, this might need a surgery.
Dr. Kayondo Simon Peter, the project coordinator at the Association of Gynecologists and Obstetricians of Uganda, reveals that unsafe abortions are 5 major killers of Ugandan women.
Unsafe abortion remains one of the 5 main killers of our women. Basically, one of the key causes of maternal mortality, death and disability of women, mortality and morbidity. It is such an issue that today we lose about 16 to 18 women a day. And of these, about 4 will die from something related to unsafe abortion. So that is one of the complications of unsafe abortion. There are many. Post-abortion infection, post-abortion bleeding, injuries to internal organs, and so on and so forth.
AUGU directly trained and empowered community-based organizations like Tostukirewa Women's Group in Bwaise and local leaders through mindset changes on unsafe abortions.
The VCAT, value clarification and attitude transformation. So I myself, I changed my attitude towards being non-judgmental, to understand why should a young girl come to you wishing to terminate a pregnancy, because of different reasons. Most of them are social, and they are not for their own making. So I've come to understand that, and through the trainings which I've been involved, I've followed up, and I've seen also attitude change among the providers. Attitude change, when you go there, they say now we give time to young girls and women, we talk to them, we counsel them, We tell them about dangers of unsafe abortion, and even we talk to them on means and ways of preventing unwanted, unintended pregnancies.
So that is when the Scrum group, together with Action Aid, teamed up to formalize the registration, which was done around 2002. For quite a long time, between 2002 and now, the Scrum group has been doing quite a lot of work in communities, in areas of humanities, where we help marginalized women and girls, people living with HIV/AIDS, orphans and other vulnerable children. Then we have other needed groups like the young people in and out of school. We have some of the elderly women here that are getting some assistance. So for the different groups that we target, we have different, I would call them core program areas. Like when we come to orphans and other vulnerable children, we offer education, shelter, health, food.
The trained leaders go back and inform their respective communities of the dangers of unsafe abortions, prevention of likely cases, and end stigma.
Yeah, so AAGU has engaged a lot of the media practitioners in their groups, both print and also televised and radio. Also, AAGU is part of a consortium of CSOs who advocate, who do a work in the area of unsafe abortion. Like for example, SEHAD, the legal teams, and Tustukirewamo, the community teams, and so many other players in the area. But even of course the Ministry of Health, which also is the leader in dealing with the problem. So AOGU is working as part of a consortium and a lot of our work is to provide the right information even to the consortium. Make sure that they are communicating the right data, right impact, and things like that.
Perhaps the epitome of the project is that AOGU created partnerships with both organizations like the Center for Health Human Rights Development, Marriage Stops, and the media, who have played a major role in sensitizations, awareness, and advocacy.
Now, the impact that this project and our engagement with AOGU has had is that they're more confident in terms of knowing what they can do within the limits of the law. They are more confident to speak about their experiences or lived, stories in the field, because they also realize that what is lacking is actually voices that speak up from a professional or expertise point of view. Now, this has boosted our relationship with AOGU, but also with different stakeholders, like with the members of parliament, the media, because we've provided learning exchange forums where myths and misconceptions are broken down and people are equipped with the right information or facts that relate to abortion, from the science bits to the legal to the advocacy. And this has seen the AOGU take more participation when they are called upon to give, expert information before committees like in the Uganda Law Reform Commission, before parliamentarians, during community engagements and media engagements on reproductive rights. We've had people come out to speak, which was not the case before.
Dr. Francis Pebalo from Gulu University says that AOGU has urged healthcare workers to understand their role, not to cast blame on abortion victims, but rather to give them the much-needed health care without discrimination.
Post-abortion care package that has been published, actually it's being advocated by Ministry of Health. It has one part that has been for a long time neglected, and that is actually community linkages. Many of these mothers, if they come to the ward, we help them, and they are going back home. There should be a community linkages so that that stigma is reduced. So I think as AOGU, they thought we should involve the nearest people to these people, actually the village health team, the nearest people in the what? So most of these VHGs were invited, and I'm happy to say that with that, there has been a lot of change.
Benson, one of the beneficiaries of advocacy, shares on how it has impacted his life and his community.
So in our work plan, all our move as leaders is to do the awareness creation and sensitization of the community. We make them know in the line of goals and objectives. We have to make them know what is safe abortion, what is sexual reproductive health. When somebody talked about those two words, what comes into your mind? But when I attended that program, I was really impressed because I got so many informations and tools which empowered me.
The responsibility to end unsafe abortion belongs to everyone, and AUGO continues to advocate for safe abortion practices to reduce the dangers associated to unsafe abortions across Uganda.
The commitment is to reach the most hard to reach areas. And that has been the greatest contribution, that from advocacy, how then do we support people who have attempted to do unsafe abortion practices? So Maristops comes in with post-abortion care so that we reduce the deadly effects. And through that, then we are contributing towards the reduction in maternal mortality and morbidity due to unsafe abortion, which actually the project is about. It's family planning provision. It also does sensitization about sexual reproductive health and rights. Issues to do with STDs, sexually transmitted infections, how to prevent getting infections and so forth.
With an extension 1 year to this project, Dr. Process Chimpi shares on the way forward for the project.
But I want to look at other people who had not benefited from it. I am a mentor, I am an advocate, I'm a trainer. But to other people who are coming on board, can everyone have a chance to train the other? Can we widen the scope so that many people can actually be mentors behind this? Can we create, come out with a different aspect of seeing this project work for itself, that by the time FIGO says, I've stopped, at least us as individuals, us as AOGU, can thrive to move along. So I wish